What's up, guys? Today we are doing a dive into what's in your marijuana. It's a new look into looking at that alphabet soup that you find on your label and helping you figure out what is going on there. What are you actually consuming and what is it doing to your body? We have Dr. J on the line to help us get to the bottom of it. She's our friendly neighborhood medical marijuana doctor. She's a practicing physician. She specializes in medical cannabis and she knows what's in your weed. She's going to help us today figure out what the heck is CBN. Dr. J, thank you so much for coming on. I am very excited. I cannot enough.
Absolutely. Me too. Thank you. Me too. This is good information we're going to share.
Yeah, I think so. But before we get into it, I have to let you know, I'm a very smart man. I know a lot about marijuana, especially that CBD stuff. See it everywhere. Know all about it. CBN, I saw that the other day. It's one letter off. It's most likely the same thing. Am I right?
Absolutely not, but bless your heart.
Oh, bless your heart. I know what that means. I know what that means. It's not nice. Yeah. So tell me, what the heck is CBN actually? What is it?
Yeah, so CBN is short for cannabinol, which is a minor cannabinoid. So basically not THC or CBD. That doesn't have nearly as much data or research behind it as far as what it does in the human body compared to THC or CBD. But it still has some clinically significant, some meaningful effects for folks who are looking for certain symptom relief or certain effects from their cannabinoids.
Okay. Now it's so where do we get CBN? Is it naturally present in the plant?
So CBN comes from the breakdown of THC due to oxidation. So basically, light, heat, hot temperature, and exposure to oxygen will cause the degradation of THC into CBN.
Okay. Is it interacting with us in the same way? Am I gonna get high if I rolled a whole J of CBN here?
So it's what's called a partial agonist at both the CB1 and CB2 receptors, our most common cannabis receptors in our endocannabinoid system. And what that means is it's about a quarter of the strength of THC at the CB1 receptor, which means roughly about a quarter of the psychoactivity or a quarter of the high or the other feelings you would get from THC. That's what you can get from CBN, in addition to some other effects that have been studied a little more closely.
Okay. And actually, what are some of those effects it has in the human body? It's an anti-inflammatory, am I right?
That's correct. Yep, it's an anti-inflammatory, and what it's been studied most for is for being a sedative for helping people sleep. So unlike some of the other minor cannabinoids, there have actually been several human studies, not just mouse studies, that show that CBN, regardless of whether you have it with or without CBD, will help improve your sleep and improve the time it takes to fall asleep. And there are also studies that show that CBN works in synergy with THC, so they work even better together to help one fall asleep and stay asleep.
Okay. So it works synergistically with THC. Does it do the same with the CBD, or do they not jive together?
The studies have showed that CBD plus CBN does not help one sleep more than just CBN alone.
Okay. Okay. But the sleep effects are enhanced with THC specifically.
Yeah, that's right. Mm-hmm. Yep, orally even. So that's really nice. You don't have to smoke anything or vape anything.
Okay. And do you know how effective it is on its own without THC or anything else helping it along? Does it need a helping hand?
Not necessarily. It does work significantly better with THC, and because it's from the degradation of THC, that's why a lot of times you will see it only in products with THC. A lot of the times you'll see it added in 1 or 2 milligram amounts in edibles, especially gummies, but the meaningful dosing is typically 5 milligrams to 20 milligrams.
Oh, okay. So a little bit of a larger dose makes it more medically effective.
Yep, that's right. Yeah, 5 to 20 milligrams is what they found to be most effective.
So with your patients, is there ever a situation where you would kind of direct your patients to pursue CBN on its own, like isolated? Or would you always recommend kind of?
Because it's about a quarter of the strength of THC at the CB1 receptor, and we think that its sleep-enhancing qualities are probably due to activity at the CB1 receptor. We're not sure about any other activities at other receptors that would cause it to help us sleep better. It's probably best taken in conjunction with THC. If you take it on its own, you'd probably want to get an isolated tincture form because it'd be hard to find it at affordable cost in gummies at an effective dose like 5 milligrams of CBN.
Mhm.
So most of the time when I see it, it's in tincture form or oil form, and then you can dose it much higher levels.
Okay. And do you think that's the best way to kind of consume it, or like ingesting or oral mucus, or like what's
I
the
think so.
best way to
Yeah,
kind of get it in your system here?
I definitely think orally because especially if someone's going to be using it to help them sleep, you want it to be a little bit longer acting. And when we have edibles on board rather than smoking or vaping, which has a peak in our system much quicker than taking an edible, you want that in your system for 4 to 6 hours. You want to eat it. You want it to be longer lasting when you're trying to sleep, as opposed to waking up, 2 hours into your sleep and having to redose and then risk feeling groggy in the morning.
Oh, that makes a lot of sense. I appreciate that. Um, I think we pretty clear on what CBN is. Do you mind if I ask you a few questions kind of about yourself?
Sure, yeah.
All right. Well, I think it's interesting kind of specializing in medical marijuana, especially in kind of the general field. How did you figure out that's what you wanted to do? You wanted to focus on using medical marijuana as opposed to more traditional means of care for your patients?
Well, I think so I used marijuana recreationally in high school, like many high schoolers, but I already wanted to be a doctor at that point. So I definitely remember at one point swearing to my parents when they got on to me about, certain things that you just wait, I'm going to prescribe this one day. And I've always been interested in psychoactive drugs, medications, hallucinogenics, psychedelics, all things like that. And so I was reading from really a young age about the potential medical benefits of marijuana. And again, knowing that I want to be a physician, I'd always had in the side or the back of my mind, how can I incorporate this into a practice one day? And me going through training in dermatology, I haven't finished my residency in dermatology yet, but that's going to be my specialty.
Mm.
It's not exactly something I can really shoehorn medical marijuana into very easily. I did a fellowship in cutaneous oncology, and I had some patients who came up to me asking for information about medical marijuana. And at that point in Ohio, I just had really no idea that I could have been certified to recommend at that point. And so I went online and I realized, oh my gosh, this sort of fantasy that I had in high school is actually a legit opportunity now.
Mm.
So I'd done all this research before anyway. And so I went ahead and got certified to recommend um, and started a business basically with educating patients
Okay.
and teaching them about how to address specific symptoms and not just, going to the dispensary and getting whatever the bud tender says smells like gas.
Yeah, it's high, man. It's to like 30%.
Yeah, it tastes really good, man.
Yeah. Pineapple, dude.
Yep.
Um, so, kind of a follow up on that. What role do you kind of like? It's a new age of medical marijuana. What role is it filling in the medical community that was kind of empty before this? Like, why is it here?
Boy, I could go many different ways with that question, but I think that the top two ways that it's really filling gaps are for PTSD patients who don't really have medication options otherwise that don't cause severe side effects or mood changes. And this is an opportunity to reduce the rumination and stuck in your head and flashbacks and anxiety. Of course, it can worsen anxiety, but again, like with all medications, you find the right dosing and people get relief from PTSD symptoms without the side effects of all the other mood altering medications. And that's one. Number two is pain management. I can't tell you how fulfilling it is when my patients gush to me that they were able to get off of their opioids. They no longer need gabapentin. They no longer need their Lyrica. I mean, all sorts of medications. They're anxiolytics, their Xanax, their Valium. They're getting off of these medications.
So, it is an
And
effective alternative to opioids. That's fact.
it is life changing, absolutely life changing. And of course, there can be, dependence on anything, including marijuana products. But from what I've seen, I mean, I don't have to warn these patients when I recommend medical marijuana about, naloxone and stopping breathing and the risk of death. It's hold on to your couch and open a bag of Lay's. I mean, there can be side effects, of course, but nowhere near when I was prescribing opioids to cancer patients.
Right. So, with these patients, they're coming to you. Are they coming to you very fresh? How much do they know about marijuana kind of going in, or do they know really nothing?
Yeah. So, um, I see, I work for a medical alliance in Ohio, in addition to doing patient education with my business. And so I see a wide variety of patients. I see brand new patients who, I talk to their parents because they're an infant with a terminal seizure syndrome. I talk to patients who are, 96, 98 years old, who know nothing. I talk to patients all in between those ages who know from little to they've done all their Google fooing and they want to teach me something. It typically doesn't work very well and I don't appreciate it. But, it's the whole gamut, the whole spectrum. The VA vets who only want to smoke flower, whether it's allowed or not in the program, and that's fine. If it's not broken, don't fix it, to the folks who only want to use the latest and greatest in broad spectrum tinctures and they want to microdose and everything. And it's so fulfilling because unlike every other medication where I tell you what to take, how often to take it, when you come back to me in a couple months or a year, you tell me what has been working best for you and I can help you troubleshoot after my initial recommendation. So that's really nice too.
Nice, nice. So you obviously you support medical marijuana. That's not a question here. What are your feelings about marijuana as a recreational substance, though? How do you feel about that?
Yeah. I'm of the mind that people should have access to it. There are always going to be people who misuse and abuse. Unfortunately, the things that we can currently misuse and abuse include very legal and accessible things already, like alcohol, aspirin, Tylenol. Opioids are becoming less accessible, fortunately, but those are easily abusable. So I think when it comes to the opportunities for therapeutic benefit weighed against the potential harm with medical marijuana, the scale is, it's very tipped in favor of all the medical benefits. So even if someone is not getting their medical card and they're using recreationally just for fun, I think still the risks are much lower than using another substance for fun. So I am for recreational marijuana use with regulations for sure.
Yeah, that makes a lot of sense. And last question, this one's just for me. You're featuring in you're focusing on dermatology, right? I've always been super skeptical of like skin salves, like hemp products or cannabis products, THC products absorbed through the skin. Is that really effective?
It really depends. A lot of the lotions and balms and salves, they do absorb pretty well in the skin. It just sort of depends on the vehicle. So whether it's a lotion or an ointment, like an ointment is much thicker, there'll be more absorption. A lotion will absorb less. You definitely want to get your product from a pharmacy, a dispensary or some other regulated place to make sure you know what's in it or have a lab analysis available. But absolutely, transdermal absorption of THC, CBD, and some of the terpenes even enhance transdermal absorption. Definitely a thing and definitely helpful for superficial to moderate depth pain, not deep stuff.
Okay. Dr.
Yes,
J,
they
thank
work
you so much. I appreciate it. I feel like I've grown as a person. I'm much smarter than I was. I was wrong before. But thank you so much for coming on and helping us figure out what the heck is CBN.
Thank you so much. Thank you. You're welcome.
Absolutely. Hopefully we'll see you again. Guys, don't go anywhere. We got more for you coming right now.